these services should be made available at the government hospital level in their location. If these were made possible, then they don't have to uproot themselves, the entire family for that matter, to just get this service for their one child. Now, the problem becomes multiplied because of the relocation. The economic situation of the family is affected, the interaction in the family because other children, other family members will feel not prioritized, of course. Their needs pile up. And at some point, even if the services are still available, they themselves will end up giving up. It's not so much as being hopeless, but they have to follow what the government has set in place for them. Now, although it is intended for the general good, sana when they are relocated, services are also in place where they are relocated. That way, the child will continue to improve. Medicines will be a close second problem in that sometimes the availability of the medicines are not steady. A patient earlier was telling me about her child being prescribed valproic acid, and then it became it was pulled off the shelves, and the child has to take this every day. Before it can be replaced, they have to go back to the doctor, and the doctor will have to prescribe, and so on and so forth. So the cycle continues, and goes without saying that you should have the money. The premise, of course, is you have money to pay for these medicines. Now, I was asking them if money were not a problem, is there medicine to be bought? Sometimes nga daw wala. So, ano yung problema? Is it the supply? Is it, I don't know, stocking it in the different drugstores? Or what? We don't know where to start looking for a solution. For now, PhilHealth, I did raise this question during one of the discussions. It's for in-house, rather confined patients. So the services, the point I raised was these rehab services should be considered for inclusion in PhilHealth because it is part of the recovery process. And the recovery process need not be a confined stay in the hospital. It is availed in the hospital premises, but the patient need not be in the hospital. They're on an outpatient basis. Well, it's been made into law already, I believe, that government hospitals should have rehab departments. I think that's a good start because that will redound to a trickle-down effect na pati manpower tatamaan. I suppose better record keeping or, directional whatever. If there is really a procedure, then let's not reinvent the wheel. Kung dito pupunta, dito pumunta. Hindi yung wala po doon eh. And remember, these are parents who are accompanying their child who needs to be looked after. Well, it's everybody's concern. Like I said, at some point in our lives, we will find ourselves in a hospital. Hopefully, we are just there to visit people. But if we find ourselves confined, we are in the system. And we want to make sure that our needs are met. How do we make sure that these needs are met? We get our voice heard. We participate in these things. For our particular population, it pays to be in a group. Not pay as in monetary, ha? It's difficult to, what I've been seeing kasi is they tend to go solo with what they're bearing. Rather than, misery loves company, if that's what you call it. The community sense of sharing, even if it's a problem, a triumph or what, nawawala. And it's something that we want to instill again in them, that we are sharing the same air here. So what I'm feeling is probably what you're feeling. Let's say it in one voice. Let's practice this, and when we are going to ask for help, our voices have a better chance of being heard if we all said it together. Yes, one voice.